Hello, and welcome back to the Healthcare Executive Insights podcast. My name is Elliot Sloan with the Macallan Group. Today, we are very excited to introduce our guest, Mr. William Kenley, who is the CEO at AnMed. William, thank you so much for taking time to chat with us today.
Thanks, Elliot. It's an honor to be here with you.
The pleasure is all ours. Let's start with a little bit of your professional background, and then we'll learn more about AnMed.
Sure. I joined AnMed 3 years ago. Came to South Carolina, upstate South Carolina. I had spent the last 17 years in Tennessee in the Memphis metro market with a system called Methodist Le Bonheur Healthcare. I was the executive vice president responsible for what we called the community group, which was basically all our community hospitals and the attributed practices and ambulatory services that went around those, all around the city of Memphis.
Sure.
Prior to that, I was an executive with HCA in Middle Tennessee and was CEO of a hospital that we managed called Northcrest. Was an interesting opportunity. It was a year-old hospital when I went there, and it was a great experience to actually build something that was greenfield, which doesn't happen too often in healthcare. But won't go back much further than that. But I had a couple of hospital roles before that. I'm a product of Duke University's MHA program, which to give a shout out to Duke, that wonderful opened up doors for me that I never even knew the doors were there before I was at Duke. Great starting point for me. And I was an administrative fellow at Geisinger up in Danville, which was my first big exposure to a fully integrated healthcare system, which is what we're striving to be here at AnMed today.
Wow. So you've been a part of hospital systems, big, small, medium. You've seen it all, it sounds like.
I have been in rural markets, more metro markets, primarily, but not exclusively turnaround situations. But the situation we're in that I have here, the opportunity here is really a wonderful opportunity in that it's we have a strong history of success and a strong position in our market, but a real desire to build on that success to be more. To do more, be more in our community. We're fortunate to be serving in a community that is population is growing. The economics are growing as well in upstate South Carolina. And there's just great potential and great energy to build on our success and be more.
Yeah, tell us a little bit more about your footprint and your specialty. What is AnMed's really focus with delivering care?
Sure. Well, we are over 100 years old. Started as a community hospital. We're the second oldest hospital in the state of South Carolina.
Wow.
But we have grown from there to today. We are 4 hospital campuses.
Sure.
We have a medical group of about 250 physicians.
Wow.
We have ambulatory care sites, a little more than 60 across Anderson and surrounding communities right now. And we are aggressively working to expand beyond that. I'm very grateful that my predecessors and the folks that are here before, we are enjoying the shade of trees that were planted in their time. And we're planting more trees today, which is great for our future. But our medical group is a huge piece of that. It was one of the things I was most impressed with when I first became aware of this opportunity, was the integrated nature of the entire organization, but really the culture and desire to just be more and do more. You can see behind me our tagline, our new tagline, "Better starts here," and we really live that it means individually for every patient that puts their faith and trust of us, we want better for them. For every family that puts their faith in us, better for them. But really overall, our focus is providing a support for a better quality in life in the upstate of South Carolina for everyone, whether they work with us, they live as our neighbors, they're one of our medical staff or whatever. And I'm very inspired to have a great group of people that are on fire about that. And
Sure.
just a lot of fun. It's a fun place to be. We have a lot of challenges. It's no place is utopia, but uh, I couldn't be more thrilled about the opportunities because of the team that we are addressing them with.
Yeah, that's terrific. And I know every medical group, whether you're a private practice or a health system, is dealing with serious challenges these days. Um, the cost of labor has gone through the roof. The
Yes,
reimbursements have stayed stagnant
yes,
at best. I know there are so many different areas that you're looking to just maintain the quality of care that you can deliver to patients, and
yes.
improve it.
Well, absolutely. And it's we're kind of beyond that point that the way you respond is you just have to do more. We need every physician, instead of seeing 24 patients in a day of clinic, they need to see 26 patients a day. I mean, there's always opportunity for efficiency, but generally we're beyond that. We're beyond that. So it's kind of on a bigger scale when we look at the whole organism. What are our opportunities to be able to take care of patients more efficiently in the right setting, and then keep them connected throughout their entire care, because reality, that's best for them,
Yep.
but also from our economic engine, that is the soul of who we are. That the primary care doctor connected to ancillaries, connected to the specialist, connected to the hospitalist, connected to the ED doctor and what goes on there. All of those things have to work well for us to be successful. The other thing I would say, that it's great because we have all those pieces put together and connected. It gives us opportunities that more siloed organizations just don't have,
Yeah.
and that's really great.
And that seems like maybe it's truth, maybe it's my opinion, but that seems like the biggest problem in healthcare in our country is the lack of continuity of care and the lack of communications between specialties.
Mhm.
And when you have a system and you have a big footprint and you could be tracking from primary care to specialists to surgical centers to the hospital, and you are always a part of that patient journey, it just seems like financially it makes so much sense. The outcomes for the patient, it makes so much sense. You're bringing down the burden to our economy on healthcare costs, which we know is a huge nut of the GOP.
Yes.
Um, you know, why is it so hard to get unified healthcare in big markets?
Well, I think there's a lot of reasons for it. There's a lot of sub-optimization. Sometimes the individual goals within those operating entities don't necessarily they're not all synergistic over the whole continuum. They're just not. I mean, we recognize, for instance, in our primary care is a big piece of our integrated health system. It is extremely difficult, if not frankly impossible, to operate a significant primary care footprint that is not subsidized with revenue from something other than E&M codes.
Sure.
It just really is. So the practices, and we do have independent practices in our market, and we love working with them. I give them a lot of credit because they have got to find ways to make that happen, because we all are in the same operating uh, field, so to speak. It's kind of the
Same
challenge.
arena.
Yeah, we're all there. We're all swimming in the same water. So that makes it very, very hard.
Sure.
Um, I also think patients have a big role to play, that um, until we get to a certain point, it's just my opinion, but as I get older, I can see when you're younger, episodic care is great. Healthcare is seen somewhat as uh, an intrusion into your life, a short intrusion. I've got to go to the doctor today, kind of like going and get your teeth cleaned. I don't need I don't need a relationship, but there does come a time that you wish you had one.
Yeah.
But how do you balance that out? I think one way, we're not novel in this, is doing the best we can to establish primary care relationships, even if you
Yeah.
don't use them a lot. Primary care relationships is one. Another is the electronic medical record. We are we utilize Epic. So
Sure.
my chart is our electronic health record, and I have to say I've been really impressed with the ability to connect all the aspects of our care and potentially to connect to health data information that's outside our system, but can be fairly easily grabbed by our providers from other Epic providers. That's really, really important.
Yeah.
Um, and I've definitely seen in the last 5 years an increasing desire for patients to utilize my chart and really see that as their longitudinal record. And so we're trying to accelerate that by doing things like online appointments
Yep.
that folks can take more control, pushing out health improvement messaging, opportunities to be in better health, and connection and reminders and things like that. Again, not particularly novel. Other places I know are doing this. The thing I'm excited about though is the percentage of our population that sees that as an advantage and as an asset
Yep.
is growing. Now, I
Yeah.
don't know if that's national or not. I hope it is because I think it's a good thing. But we're still really seeing that grow, and I think that's encouraging for our future.
For sure. And the EHRs have been so fragmented and they're
Yes.
starting to become open API and they're starting to speak to each other. And that has been such a bottleneck, right? For groups that are not under the same umbrella, right?
Yeah.
But your cardiologist needs to speak to primary care,
Yeah.
who needs to
That's been a
speak to,
bottleneck. The other thing that's happening, Elliot, and maybe this over time is not the greatest thing from an economic dynamic, but the number of EHRs. I mean,
yeah,
the footprint, there's pretty much three big providers in that space,
yeah,
and there's really one really, really big provider in that space,
yep,
uh, the one that we utilize. And as more providers are using them, that's making it better for us to be able to cross communicate as well. Over time, as that becomes, and as we recognize it almost like a utility,
hmm,
what does that mean economically? I know we invest a lot in our EHR. And if you ask me, do we get an economic return out of it? I don't know. It's hard to say. I can go back 20 years ago. I was recruited to Methodist, and my role was to put in place the first computerized physician order entry
wow,
system in a hospital in Memphis. And at that time, you would hear paybacks like, well, we're going to pay this back. Look at all the paper we're going to save. Well, I would tell you, there is not enough paper, not enough trees on the planet to pay back this. It's We didn't understand what the payback really would be. And I
sure,
do think there's a return, but that return, and I guess this is appropriate, doesn't just inure to the health system or the provider. There's a return to
to the
the
patient.
individual, the patient as well. And I think that's a good thing, but it is a significant investment for sure to make. It doesn't just happen.
Yeah. It's a big undertaking to switch systems. We know that. And
Oh, huge, huge barrier to entry. Yes, extremely painful.
yes. But once you get there and you get over the hump, it all starts aligning with the vision and it makes sense, right? It's just a little bit of pain before you feel the glory.
And if you can all speak, well, I remember telling some folks way back then that our challenge would have been easier if you would have told me and given me a drop dead date that all the physicians and providers in that hospital in Memphis, by this date, we would communicate in written form and verbally in Italian. It would have been easier. It would have been easier because we just didn't really understand the change. The goal then was basically to take every process, everything we do, writing it out and putting it into an electronic environment. That
Yeah.
was the initial goal. And
Wow.
that's ridiculous. And it will not work. And we've gotten past that now. But it's taken a lot of time and a lot of pain. Today, one of the reasons it works is for some people, and it's for not for everybody still, it is an asset to provide better and more efficient care.
And it seems like Epic is the go-to choice for hospital and health systems, but then on a private practice level, at least in MSK groups, you're looking at Athena,
Yep.
ECW, Practice Fusion. And the question is, if the consolidations are happening, then why don't those top five for private practice and the top one or two for health systems speak to each other?
Yeah, I think then it gets back to the economic incentives are not aligned. We've seen those too. I mean, we offer that we have an opportunity to help private groups in our market connect uh,
Sure.
through our my chart, and I understand and I've been there. You look at the cost of the software that you're using, and sometimes the big integrated suite costs a lot more, and it's just not feasible for a two-person or a solo or a three-person practice to be able to take on.
Sure.
But when we look at it from our standpoint, and it's not always true, but getting them connected into our electronic universe, so to speak, provides some other values beyond that, which allows us then to consider ways that we can help it be as cost effective within what compliance will allow
Sure.
to get them onto the system. And most of the time that's been favorable for our private physicians around our market. We have a number that are involved with us in that way. So that's a good thing, and because it helps so much with critical values, communication, that frustration of, well, what do you mean it's not in my record for the patient? There's a lot of opportunity there, but there has to be a recognition and a willingness to go through the valley as you described to get onto the system, not just financial investment, but time and learning a new system too. I do think providers in a very different place today. It used to be, oh my gosh, going from paper to electronic is a lot harder than going from one electronic system to
To
another.
another. Yeah.
They're all different, but we've gotten kind of used to how it rolls, so that helps.
They're learnable.
Yes, definitely so. Definitely so.
And it seems like not only the systems are a big problem to tackle in healthcare, but it's preventative medicine versus reactive medicine.
Yeah.
And that speaks to the systems and the transparency of people's health.
Well, it does, and to a large extent, I have a great percentage of our primary care physicians that's what really gets them excited and jazzed. They want to be able to do that, and we try to support and provide time um, and structure to be able to do that.
Sure.
But like many systems, where we're at in the continuum of uh, pay for per episode to a quasi-capitated model, we are somewhere in that continuum with different payers.
Sure.
So you have to balance all that out. But I appreciate very much the energy and excitement of it, and it's consistent with what we are about with Better Starts Here. And we are committed to making that happen uh, jointly with commitment to the things that we have to do to be economically sustainable, to be here, to be able to make that evolution.
Sure.
Uh, but it's great to have physician partners that are engaged and excited about that.
Yeah, I mean, I think that's what everyone is driven toward, right? Is being able to deliver to their patients ways they can improve their health before their health is deteriorating, and give them the tools and the resources to be preventative versus reactive when things are not going great.
Well, and looking at different population groups, I know there's a lot, rightfully so, a lot of focus on equity
Yeah,
uh, amongst groups. And in our primary care group recently, over the last year, they have we have targeted differences in how we take care of different groups relative to diabetes care.
yep,
And first, we saw that there was a difference. There was definitely a difference in key metrics within populations, and they put in place an action plan. And we look at it today. I'm proud of the progress that they have made
Hmm.
with this targeted action plan, and that's the way it needs to be for our community, for everyone in our community,
Yep.
and everyone in our group, uh, including our board of trustees, is very excited about that and very proud of that. So that's a neat thing to be a part of.
This is a good segue into our next topic, which is the importance of culture in a health system. Talk to me about why it's so important to have a strong culture to be able to deliver the right and effective care to your communities.
Culture is just huge. When I talk to our team here, I I share an equation for we strive for exceptionalism. So I say the equation for for exceptionalism is an exceptional plan plus exceptional execution plus an exceptional culture can deliver exceptional performance. But I would tell you it's really more the plan plus execution with parentheses around it, with culture being either being an amplifier or a reducer. That's a
Got it.
more correct equation, I think. Your culture, it's either going to be your gas or your
Yep.
brakes, and
Yep.
it's going to be either one. It's going to be either one
There's no
because
middle of the road.
no, you have culture. You have culture. We work hard at it. It's critically important that people understand. I mean, what is our purpose? And understand how they fit into that purpose, to feel a connection to that. It's one of the great blessings of being involved in healthcare. I don't think there's anything else out there that people can have a more personal, heartfelt connection to than this. If you can't get jazzed about this, I mean, no offense to a lot of other industries, but
Yeah.
it should really get you to your core.
There's
Uh,
no other way to serve better.
no, it's got to come from your heart, and then it includes respect for one another and the people that are putting their faith and trust in you, and a real ownership of culture. It's vitally important. If you can have a productive, create a culture that is productive, and cultivate that, it is going to accelerate and make your results beyond what you can ever do just with great planning and execution. Conversely, if it's toxic, it's going to drive it the other way. It's an area we work in a lot. How do we do it? Um, a person at a time, a
Sure.
person at a time.
One
Uh,
voice at a time.
yes, telling stories, how we live, celebrating things that people on our team do.
Hmm.
Some of them are would be viewed as being very, very small. Things like instead of telling someone, well, I'll tell you a quick story if that's okay. That
Sure.
a member of our cardiology practice a few weeks ago got a call in the morning, mid morning, from a patient that was very frustrated, was trying to drive from Georgia to the office, hadn't been to the office before, and got lost, and was calling and say, "I can't find your office." Well, it would have been generally appropriate for that person to say, "Well, Mr. Smith, first of all, do you have an iPhone? You can put the address in." Didn't say that. Could have given him the address and gave him
Sure.
direction. Didn't say that. What she did do was ask him where he was. And then she went and got in her car, drove to him, and said, "Stay right there and you follow me back to the office."
Wow.
That's that's an engaged culture. And while this wasn't her purpose, what I've shared with, I mean, our cardiologists are fantastic. They're fantastic docs and they're great friends. Do you think that individual will ever choose another cardiologist? I would say no, never
Never.
again. And it has nothing to do with the cardiologist. It had everything to do with the young lady answering the phone.
Yeah.
That's the power of culture.
Yep. Yeah, you could hire the best and brightest providers, but if you don't have a good culture on that front line, that receptionist team, that front desk team, the mid levels, the nurses, the PAs, it doesn't matter how excellent your doctors are. It
It
really doesn't.
doesn't. It doesn't. It doesn't. And I think more and more folks in our industry understand that. For a long time, I think that was really lacking, but there's more focus across the board with it today.
Yeah.
But we all have opportunities still, though. And I think some of that is the challenge of there's so many different things that can come through the door at
Hmm.
any given time. I had an experience recently with a dental office, and I came out and I told my wife I was so impressed of how my experience went and how the dentist questioned the hygienist in front of me to give her an opportunity to share what her caregiving was to me. Built her up it was very focused, really impressive. I wish we could do that every time in our emergency department.
Yeah.
Uh, and I think we have to try, but the reality is we don't schedule 8 patients a day for hour slots, and they know they're going to take bite wings, no offense that it's not hard, and clean my teeth, and then have a 2-minute version of a physician assessment. We're
Sure.
going to have gunshots, heart attacks, mental illness. Someone came in that didn't have prenatal care and is having a baby. It's wild. But that sounds like an excuse too. We've got to get better with making it be that way.
Yeah, and it sounds like you guys are moving mountains when it comes to really giving everyone a voice from the bottom up.
We're trying. I mean, if you don't have ownership, you're only going to go so far. You're gonna only going to go so far. And with our physicians, uh, it's wonderful that I don't ever want them to feel like, well, we're just employees, and there
Sure.
isn't such thing. There isn't such thing whether you clean rooms or floors or you're a heart surgeon here. That's not the case. It shouldn't allow anyone to feel that way, but particularly our physicians. A large percentage of our group are employed; they're salaried with
Sure.
us, but they also maintain a high degree of ownership, and I want that because these are really smart people.
Sure.
They're innovative. Uh, they know what works. They know what won't work. Uh,
And you can lean on them.
and they'll make it work if they feel like it's theirs and they're an owner.
Yep.
So we strive to make that be the case.
How do you establish that feeling of ownership?
I think it's connection first. They have to know you. There has to be connection throughout the whole organization.
Yeah.
Respect and understanding what they're bringing to you. It doesn't always mean that we say yes. We can't say yes all the time, but we can try to close every single loop and help folks understand if the answer is, well, no. Rarely, frankly, is the answer no. It might be not now,
Sure.
but not no. But closing that loop, letting them see that their voice is heard.
Yep.
Uh, some of that's a little scary sometimes. I mean, even for me, I mean, it's scary. We've got a town hall coming up next week with wide open with whoever physician wants to come that evening. And I've got a couple slides that I'm going to share. This is what we're trying to do. These are the challenges that we have. This is what success will look like.
Sure.
How can I help you help me help us be successful? And it's a little scary.
You're
And I
opening up the
expect,
floor.
yeah, and I expect we'll hear everything from, well, you could pay my surgical tech more so we stop losing people, or you could open up more ORs. And, some of those things are correct.
Yeah.
But we've got limitations that we can't do that today. But
Sure.
that doesn't mean we don't need to hear them and talk about them and mutually own them, because most of the time, uh, physicians, they get it. They get it. And by nature, it's their job, I think, to push too. And I understand that. I like to push a little bit myself.
If you're not pushing, you're not progressing.
Exactly. 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 Exactly.
So tell me a little bit about what technologies or processes you've implemented to improve patient care.
Well, we've done a lot of things. I would tell you, we've talked about it a little bit already, but leveraging our EMR,
Yeah.
my chart, that's been a big one for us. We have we're moving into more virtual care.
Yep.
So that's another
Telemedicine
thing.
visits.
Telemedicine visits. We're asynchronous right now for some primary care visits, and we're doing some subspecialty visits as well. That is going well as well, some behavioral health, some. So it's a combination of increasing access for in some areas, um, limited subspecialty coverage. So it's a way to bring more services to our community and others. So that's another. Online scheduling, I mentioned. Uh,
Sure.
we are utilizing a company called Cedar to help us with our upfront scheduling, communication with patients, uh, all the up to the time they come through the door process. That has been helpful. Also, we're utilizing them to consolidate all of our billing. One of the biggest frustrations that people have with regard to healthcare, we're trying to make our bills look more like what you would see in a modern, if you buy something from Amazon, bringing together the physician bill, the hospital bill, the ambulatory bill, the pathology bill, all those things together so
Yeah.
it's understandable.
Yeah. Transparency for your patients.
Yeah. Another big one that I've been a little bit surprised, frankly, how well it's been received. We use a company called Simplify to all of our physician scheduling and keeping up with work RVUs and projections and everything was done on an internal system. Simplify, we've just moved to that allows physicians hands-on on an app to be able to keep up with their schedule, their work RVUs, all these things. And I've been frankly surprised at the amount of positive I've gotten back from physicians that
They
really
love it.
like that transparency and how easy it is to use. So that's a good thing for providers. Uh,
I think
we've
you
moved,
also mentioned outpatient care. You guys have quite a few centers outside of the hospital.
we do. We have surgery centers, imaging centers, rehab, uh, wound care, uh, probably missing some. Do a fair amount of sports medicine as
Sure.
well. So
You're putting care in the communities and trying to make it so outpatient care can go to outpatient, only critical care comes to the hospital,
correct.
which is creating more access.
It is, and a big one here in Anderson is we've consolidated all of our inpatient care at the medical center campus. We have another campus, our North Hospital, that's 2 miles away, not very far, but 2 miles. We had inpatient at both places. We've consolidated it all to the medical center, and we're utilizing that outpatient campus, which is a big campus, sprawling, beautiful land
Sure.
and building. It's our outpatient kind of mega center, if you will.
I love
Uh,
it.
and we're working back through redoing a lot of that space, and it being ambulatory space, physician space, which is a lot of that there. Also, continuum of care. We made a deal with an LTAC, a long-term acute care
Yeah.
hospital,
Yeah.
that's moving into that building
Sure.
on one floor, and we'll have that. We haven't had it here before, and we also doubled the size roughly of our behavioral health service and relocated it kind of a traditional service on the eighth floor of the medical center out there into a much more conducive setting. And we're going to have a more comprehensive outpatient behavioral health. It's a huge need in our community. So
Of course.
targeting the assets we have uh, to be able to provide better care. Also, as we're building new places, we're building with that kind of philosophy in mind.
Yeah, it sounds like you really are, looking at all avenues to potentially get more ingrained in the communities with meeting them where they need to be met to deliver the care you need. Um, and you talked about behavioral health, mental health. I mean, we could probably have a whole nother podcast episode talking about paring down on physical health and mental health and what a big gap there is there.
I'd love to come back and talk with you sometime about it. We're doing some neat things, I think,
Yeah,
and it's just a huge need.
it's
It's
crazy.
it's a huge need. Um, so sure, anytime I would welcome that conversation.
I will leave you with this question. What, in your opinion, is the most pressing issue for health systems going into 2024?
Well, for us, it's expanding our access in our growing community. We're in a very competitive area that's rapidly becoming more competitive. So we need to grow our access. In addition to that, staff recruitment, development. You mentioned it before, just the ability to get staff, whether we're talking about a physician, a nurse, or a tech. All of those are big opportunities for us. And then the last thing I would just say is kind of playing off of what you said before, just accelerating as fast as we can, that philosophy of meeting our consumers where they are, whether it be a virtual visit or an outpatient visit or a doctor's visit or a major surgery, meeting them where they're at and making it logical and as easy as possible to access and be a part of our system and see value in being a part of the AnMed system.
Makes a lot of sense. I think that you guys are really leading the charge into an uncharted territory. And the reality is, hospitals are no longer just brick and mortar. Hospital services are not just the hospital that you know of at the corner.
Oh,
It's
no
much bigger
doubt,
than that.
no doubt, Elliot. Well said. I mean, one of the exciting things for us next year, we're going to open a new campus, a micro hospital campus with a 24/7 freestanding ED there. And while the planning of the facility, the bricks and mortar, all of that's huge, we're putting way more of our time into the focus of who we hire, how we train them, what's the culture, what's the processes that we're going to have there. That's the key. Yeah, you want a nice building, you'll fail if that's your most important thing. That's just
Sure.
the shell. That's the shell.
What are
We've
the
got,
guts made of?
yeah, that's what we're working on.
I love it. William, thank you so much for your time today. I know our audience will have some really awesome takeaways, and I know the communities in South Carolina are blessed to have AnMed in their backyard. So thank you so much for your time.
Thank you. It's a blessing to be with you.
Yeah, and we will definitely take you up on another episode next year. So you will hear from us sooner than later.
Sounds good. Look forward to it.
Thanks so much. Happy
Thank you.
holidays.
Happy holidays.